Yeah.
हेलो हेलो आंटी सर स्टार्ट करें
हाँ ठीक है।
थैंक यू सर वेरी गुड आफ्टरनून नमस्ते एवरीवन। आज इस ज्ञान-गंगा वीकली वेबिनार सीरीज के 101वें सत्र में मैं डॉक्टर पूनम वाजपेयी राष्ट्रीय आयुर्वेद विद्यापीठ की संपूर्ण टीम की ओर से सभी माननीय अतिथिगणों का, आदरणीय गवर्निंग बॉडी मेंबर्स, आदरणीय गुरुजनों का, आज के हमारे प्रवक्ता आदरणीय डॉक्टर विजय डोईफोड़े सर और सभी स्टूडेंट्स और सोशल मीडिया लाइव व्यूवर्स का स्वागत करती हूँ। आई वेलकम यू ऑल इन टुडेज 101st सेशन इन दिस सीरीज। सत्र आरंभ से पूर्व में परम आदरणीय पद्म भूषण वैद्य श्री देवेंद्र त्रिपुरा जी, प्रेसिडेंट ऑफ गवर्निंग बॉडी आरएडी, आदरणीय वैद्य श्री मनोज देसाई जी, एडवाइजर आयुर्वेदा मिनिस्ट्री ऑफ आयुष, आदरणीय वैद्य श्री अनुपम श्रीवास्तव सर, डायरेक्टर ऑफ आरएडी, इन सभी को उनके निरंतर मार्गदर्शन, अपार सहयोग एवं निरंतर प्रेरणा के लिए धन्यवाद देती हूँ और सादर प्रणाम करती हूँ। आज इस 101वें सत्र में हमारे बीच प्रवक्ता के तौर पर उपस्थित है रिस्पेक्टेड डॉक्टर विजय डोईफोड़े सर, जो कि वर्तमान में सीआरएवी गुरु के तौर पर सेवारत है और साथ ही वह आयुर्वेद रसशाला फाउंडेशन के अध्यक्ष भी है और उन्हें तिलक आयुर्वेद महाविद्यालय पुणे महाराष्ट्र से प्रोफेसर इमेरिटस की उपाधि भी प्राप्त हुई है। वो आज हम सभी को आयुर्वेद दृष्टि से इन्फेक्शन क्या होता है इस विषय पर संबोधित कर मार्गदर्शन करेंगे। He will be sharing great insights on the topic infection from Ayurveda perspective. At the end of session, you can ask the questions related to subject. अब मैं सर का ब्रीफ इंट्रोडक्शन शेयर करना चाहूँगी। डॉक्टर विजय डोईफोड़े सर is presently serving as CRAV Guru and President of Ayurveda Rashshala Foundation and Professor Emeritus of Tilak Ayurveda Mahavidyalaya, Pune, Maharashtra. Sir did BAM and MSc and PhD from Pune University. He possesses more than 28 years of teaching experience and also served as professor and HOD at Tilak Ayurveda Mahavidyalaya, Pune, Maharashtra. He has attended various conferences, seminars, symposia, and served as resource person for various workshops organized. Sir has organized various international conferences in Pune University, successfully organized World Congress of Ayurveda at Bharati Vidyapit Pune and Second World Ayurvedic Congress in Pune. He is serving as member of IEC committee at esteemed institutes like Tilak Ayurvedic College, Bharati Vidyapit, Ashtanga Ayurvedic College Pune, and many more. He is a co-investigator in development of IUS software for decision support of practitioners using Ayurvedic classes, a Government of India project. He is chief author of 2 books, namely Preparation of Directive for Sharir Terms, INSA, and textbook on Sharir Ayush, Government of India project. He has published book on Kai Chikitsa, 2nd edition. Also did translation of Charak Sita in Marathi, history of Sharir. He has also published more than 15 papers in various journals and sir is also member of Governing Council of RAV and Board of Research at MHS Nasik. He is recipient of Gold Medal of PhD thesis by IIM Pune and received Best Thesis Award, Best Teacher Award, Best Administrator Award, Lifetime Achievement Award by Sharir Shodh Sanstha Lucknow, Ratna Award by RAV also. Now I would like to request Dr. Vijay Doifode sir to please proceed with his deliberation. Over to you, sir.
Namaste. Good afternoon, Devendra ji, Nesri ji, Srivastav ji, and all Shishyas of RAV. I am going to discuss with you on the topic of infection, Ayurvedic perspective. The title itself will raise a question: how can a modern mode of disease production like infection be available in science of Ayurveda, which is thousands of years old? This is what we are going to consider. The term infection is known to medical world for last 200 to 300 years. Pasteur and Jobert were among first to recognize the potential of microbial products as therapeutic agents. In 1877, they published their observation that common microorganisms could inhibit growth of anthrax bacilli in urine. The modern era of antimicrobial therapy dates to 1936 with the introduction of sulfonamide into clinical practice. Penicillin became available in quantities sufficient for clinical use in 1941. Almost 30% or more of the hospitalized patients are treated with one or more antibiotics. Though there is no action of antibiotics on viruses, almost 50% of the cases of viral infections are treated with one or more antibiotics. And it is said that though antibiotics are not working against the viruses, they are used to prevent the secondary infection. This indiscriminate, non-scientific use of antibiotics developed increase in resistant strains of bacteria. These facts leads to involvement of newer and newer antibiotics. In this way, subject of infection and antibiotics is comparatively new. It may not be proper to claim that the fact, which is of very recent origin, is well documented in Ayurvedic literature, which is thousands of years old. It is seen that newer developments in all walks of life are taking place. Some of the original principles are drastically changed. Many have become irrelevant in today's context. The stressful lifestyle and changed diet practice of food material as well as timings created many health problems. Newer diseases such as AIDS, autoimmune diseases have cropped up. It is not necessary that information of all these new ailments is available in Ayurvedic classics. Though these samhitas were periodically updated, it is not possible to find information about these diseases in them. Unfortunately, some so-called experts claim that all this information is already available in our literature. It is possible that explanation of the problems akin to the present situation is available, which is falsely claimed to be the same. However, if any solution is found using this data, well and good. In the same manner, information about infection per se may not be found in the same words, but many other references will make the position clear. If we consider the literary meaning of term infection, it is the affection or communication with a germ, virus, or protozoa. Communication of disease by air, water, etc. indicates spread of particular disease through different routes, and a specific organism causes the disease. It may be bacteria, virus, or protozoa. In Ayurvedic literature, we find many references on this aspect. However, the term Rakshasa as bacteria and Tapaschakshu as electron microscope will be stretching imagination too much. Every science grows gradually. It is not possible that a single science contains everything. Ayurveda is not exception to this rule. In fact, initially it was getting updated after some specific time. Charak Samhita is regarded as the oldest document. It contains information about many aspects of Ayurveda. The subtypes of Vata are mentioned in Charak Samhita. Subtypes of Pitta and Kapha were included in Sushruta Samhita, which were not in Charak Samhita. Amuvat is not mentioned in Charak Samhita, but is included in later literature. Sushrut accepted the information in Charak Samhita to a greater extent, but replaced many. Inclusion of surgical procedures, surgical equipments, etc. were Sushrut contribution. After Buddha dynasty, inclusion of Rasashastra in formulary is a classical example of updating. Vagbhat updated both the Samhitas, making them easy to remember and in a reproducible form. Different Nighantus collected information about different plant material and diet, keeping the particular time in mind. This type of updating continued for a considerable time. Unfortunately, after a certain period, there was no progress at all. The old treasure was utilized as such. Though Sushrut is regarded as pioneer in plastic surgery, the major development in surgery was not through Ayurveda. Nearly perfect dissection procedure described by Sushrut remained as it is for generations. But contemporary modern anatomy, started in almost 14th century, is much more clear than what Sushrut explained. It is because progress in contemporary sciences was made use of for growth of medical science. Thus, within 300 years from primitive stage, medicine developed to most clear and simplified state. In the field of modern medicine, all the modern equipments or drugs are not very old. After 1950, the era of antibiotics started, which is still continued. Many of the original antibiotics are almost useless today. Every day, newer and newer drugs are invented. Genetic engineering will lead to human generation to such an area which nobody can imagine. A medical text which primarily targets physician be obliged to reflect the clinical realities of the day and age. A textbook of medicine written in early 20th century would contain long sections and plenty of references on diseases such as smallpox, cholera, plague. Much less space is devoted to diseases like cancer. Today's edition of the same book would present a very different epidemiological picture. Information about such diseases like smallpox, diphtheria, plague is either disappeared or abridged. Discussion on cancer, heart disease is greatly expanded. Comparatively, new problems like AIDS, autoimmune disorders would receive significant attention. The importance given in all authoritative texts to a disease is therefore an indirect but reliable index of its index and contribution to contemporary morbidity and mortality. The argument would apply equally well to procedures for diagnosis and treatment. It is therefore possible to sketch an epidemiological picture in Charak period on the basis of various references made to various diseases in Samhita. To facilitate the understanding from modern perspective, the disease could be considered under two categories, like infectious and non-infectious. Even though Charak did not envisage such a classification, in Charak's vast canvas, we might discover current maladies in true or altered form, or chance upon disease that we no longer see. Search for references of diseases in Charak Samhita termed as infection is as follows. Grahani, Jwara, Kushtha, Masurika, Shosha, Vidraji, Visarpa, Visuchika, Vrana are included in infective diseases. And non-infectious diseases include Apasmara, Arsha, Gulma, Pandu, and Madatya.
Excuse me, sir.
There are
Excuse me, sir. Please
हाँ.
move the slides as well, sir.
क्या करूँ?
Slide move कीजिए, sir. Please. Yes, sir. Okay, sir. Please proceed, sir. Please.
There are references in Charak Samhita and other classic Ayurvedic literature. The information is scattered in different sthana of the Samhita. This table will indicate the references in Charak Samhita of the above referred diseases. Let me tell you that this is reproduced from Legacy of Charak by Professor Valiasan. This is another table. Even though the term infection may not appear in Ayurvedic classics as such, we get much more information which can be considered as similar to infection. Ayurveda had knowledge of spread of the disease through different routes. These are similar to spread of infection. The information about waterborne diseases, airborne diseases was available to a considerable extent. Epidemic, pandemic occurrence of certain diseases clearly indicates that the term infection was very much available in Ayurvedic classics. The emergence of knowledge of microorganisms, the system of prevention is drastically improved. It also helped to manage many diseases with more and more success. In Ayurveda, the information about microorganisms was through Anuman. The role of organism in a disease process was considered as Agantu. Entire emphasis was to manage any disease by improving the defense mechanism of the body. Due to this attitude, information of drugs which are supposed to kill organisms is not available in detail. It was pointed out that the drugs killing microbes are included under Vishya and are listed separately. Indiscriminate use of antibiotics is leading to serious complications which are same as Vishyadushti. Principles of management of any disease as per Ayurvedic classics are Roga Mukti, that is cure, Prashama, that is suppression, increasing longevity and prevention. Main route of clearing a disease is by increasing the longevity, prevention, main preventive capacity. In this area, Ayurveda has elaborated rules of maintenance of one's health and cure from the disease. These rules are for avoiding favorable situations for a disease process, and these rules constitute Dinacharya and Rutucharya. Ayurveda advocates examination of excreta in absence of sophisticated equipments like microscope, etc. Organoleptic infections done by Vaidya himself played a major role in diagnosing a disease. The fact that these equipments were not available made identification of many things incomplete is a myth. This so-called superpower of sages, being considered as the present tool of investigation cannot be accepted. Though these instruments having advanced power can be considered as extension of perception power of the sense organ. For example, different nadi yantras used by Sushruts are now extended in different scopes like colonoscope, gastroscope, and so on. Ayurveda classified types of disease as threefold. Probably the basic of classification of root cause of the disease. These three types are Nija, Manasa, and Agantu. The disease caused by imbalance of dosha, dhatu, and mala by their improper production and activities are termed as Nija or somatic. The diseases caused by psychological upset, including stress and strain, is psychosomatic disease included in the category of Manasa Vyadhi. The diseases caused by attack of external aspects like Visha, Bhuta, Vayu, Agni, etc. are termed as Agantu Vyadhi. Charaki in Sushrut Sthan 20 explains different factors which are Agantu causes of Vyadhi. The causes include scratching by nails, biting, fall, black magic activities, curses, affection, contact of factors like amadosha, polluting substances, bhuta, pishach, trauma caused by blow, weapons, harassment, etc. References about Jivanu are available in Atharva Veda. Mahabharata has a separate chapter regarding Krumi, that is chapter number 5. Details of different Krumi Roga are available. The Krumi are of three types, Raktaja, Mausaja, and Antraja. The organisms affecting Rakta and Mausa are termed as Alandu. Different references explain the intestinal worms, Krumi. Krumi in scalp, like lice, are also explained. The colors of these Krumis is Saranga, Arjuna, etc. And they destroy different dhatus in the body and are destroyed by sunlight. In Shatapatha Brahmana, the Krumis are termed as Apyarasa, Gandharva, Sarpa, etc. Bhagavad Gita also refers to the presence of Jantu. In Kautilya Arthashastra and Vachasa Pathya, they are termed as Raksha, Rakshasa, Pishacha, Yatudan, etc. Elaborate explanation of spread of disease is explained in modern medicine to have a striking resemblance. In Ashtangrodaya, Vagbhat has given a list of such diseases which are termed as Sankramaka or Upasargik Vyadhi. The disease is transmitted from one individual to another. When one individual in sexual activity, touching each other, eating together in a single plate, working and sleeping with the individual having a disease, using clothes, utensils, and other objects of the individuals having disease, spread of the disease through respiration of the patient. These diseases which are transmitted through the sources included Kushta, Jwara, Shosha, ophthalmic diseases like Netravishanda, eruptive fevers. Charakacharya described different types of internal krumi along with their aspects on the body in the form of signs and symptoms are elaborately described. Yuka, Liksha, Pipilika, and are the external krumis which are minute, having shape of a sesame. Raktaja krumi are flat, minute, red, without legs. develop on the blood and affect kesh, lom, beard and nails. When they get associated with the ulcers, ulcers do not heal. There is itching, signs of inflammation and numbness. Elaborate explanation of Kaphaja and Purishaja Krumi resembles the intestinal ailments. The signs and symptoms are similar of both. Sushruta attributed all Kushta to Krumi. He specifically advocated use of Dhupana Chikitsa to tackle the effects caused by worms. All the explanation about different Krumis may is identical to the explanation of organisms including viruses. How they identified the structures of the organisms is difficult to understand. Though the information about helminths is as clear as is available in modern medicine, but the claim that different strains of bacteria as well as viruses were known to their minor details may not be acceptable. Sometimes certain diseases invade large population, like epidemic or pandemic. A particular disease affects considerably bigger area. The situation is explained in Ayurvedic classics and is regarded as Janapadodvamsa Vyadhi. For such widespread affection, root cause or the hetu, according to Ayurveda, is contaminated water, air, land, fire, etc. Certain kala is particularly suitable for spread of a disease. Uncommon causes are indulgence in other causes like non-observing religious rituals, curse of demons, famines, floods, etc. Invasion by Rakshas or Bhut is also considered as root cause. Ayurveda have all elaborately explained group of diseases which are included under Upasargik Vyadhi. The explanation is similar to what is explained about infectious diseases. A comparative chart explaining the modes of infection, the names of disease will help understand the common factors. These are the quotations from Ashtangarudaya considered here for explanation. Sankramanti narandaram, contagious or communicable diseases, then hetu, prasangat, gatra samsparshat, nishwasat, etc. The source of spread is direct contact, for example, skin and VD, airborne transmissions like droplet infection, etc. The types of morphology of different krumi and their prasad swarup is they are sukshma, motile or non-motile cocci, bacilli, fungi, viruses, actinomycosis. Raktagarja krumi are comparable to bloodborne infections, septicemia, viruses, etc. Amashaya sthita kaphaja krumi are comparable to typhoid, cholera, shigella, dysentery, intestinal tuberculosis, amoebiasis, worm infestation, giardiasis, etc. The diseases or signs and symptoms caused by these krumis can be enumerated as follows: Jvara, Shosha, Shula, Rudrog, Atisar, Kushta, and Netravishandha. Similarly, interesting to note the different causes for spread of epidemics. Dushita bhumi, that is contamination of water, improper disposal of sewage, Rakshigana, that is microorganisms, and Shalya Prabhav. Considering the above information, we can safely say that infection, a cause of disease, was known to Ayurveda, though not in the exact words which are available in modern medicine. However, this observation is for academic purposes. The oldest science like Ayurveda should contribute to the health care of mankind. From this angle, the available data needs to be analyzed. We have seen that indiscriminate use of antibiotics have changed the entire scenario. Many antibiotics are almost useless due to development of resistant strains and bacteria. The antibiotics also kill the normal bacterial flora, leading to many side effects. Now, we have analyzed some of the selected plant material which have antibacterial or antibiotic area. 166 plants were studied by Sarah Khan et al. Indicate that they have antibacterial activity. However, in vitro and in vivo studies against a specific organisms is lacking. Another trial was done using the plant screened where Sapindus imaginatus, almost 7 plants were selected and they were tested against 6 bacterial strains like Pseudomonas, Staphylococcus, Klebsiella, Bacillus subtilis, Proteus morgani, and Micrococcus flavus. It was found out that S. imaginatus showed strong activity against the tested bacterial strains. This was done by Nair, Calaria, etc. This is from Journal of Biology. Use of minerals along with plant material is a specialty of Ayurveda. The metals are made biosafe using different shodhana, that is purification, and marana, that is converting them into bhasma. The addition of minerals has multifold action. They increase the shelf life and potency, can reach the targeted organ at a minute level, and reduce dose and thereby side effects. One such drug is Sukshma Triphala. It's a proprietary medicine. It is a combination of Triphala and Kajali. This drug has very good antibacterial activity. It was successfully tried as a low-spectrum antibiotic in many skin, ophthalmic, and upper respiratory tract diseases. It was also successfully used for post-operative tonsillectomy care. This Sukshma Triphala was also tried by S.A. Bopegamage, a scientist from Czechoslovakia. She analyzed it in the laboratory and it found that the drug has antiviral property and was tried in many such diseases. Now, I would like to cite an example of a clinical trial which was conducted by some of us, myself, Dr. Gokte, and professors from Armed Forces Medical College. This was a trial on HIV positive patients. First, we selected 25 patients and 25 controls. They were, control group was given the modern line of treatment, and the Ayurvedic trial group was given some rasayan dravya. In case when it was necessary, Rakta Moksha was done. For lung disorders, Abrak Bhasma was given. For infection, Sukshma Triphala was given. And for intestinal disorders, Sanjivani Gutti was given. Those 50 patients were working almost on the front area for entire work. Considering a good response from this trial, we continued this trial for 50 more patients and 50 control. Other parameters like increase in hemoglobin, weight, etc. were considerable. But our claim was to improve the longevity and the quality of life, in which we definitely had success. And that's what we wanted to claim. We never claimed that AIDS is curable. Now, I would like to give a list of plants which have antibiotic or anti-infectious activity. Pippali, Haridra, Ashwagandha, Nimba, Haritaki, Bibhitaka, Amalaki, Nirgundi, Daru Haridra, and many others. Now, after this, we would come to some other aspects. No science is complete. Every science has its limitations. The use of best available modalities in each science for curing the dreaded diseases is an integration. We all know that cancer is a disease of concern. It is difficult to manage. It requires a surgery, chemotherapy, radiation therapy, etc. You cannot avoid these procedures, but for proper management, if we switch on to integration of the therapies will be useful. And for the explanation is the side effects of the chemotherapy are falling of hairs, obesity, anemia, etc. These are due to the overtaxing of the liver. The chemotherapy drugs are metabolized by liver and causing extra load on the liver. Ayurveda has many hepatogog drugs like Kutki, Tamravasma, etc., which are available in Arogyavartini. Use of Arogyavartini along with the routine treatment reduce the side effects considerably. N number of patients treated on this integrated aspect. Another example is about repeated attacks of urinary tract infection. After culture and sensitivity, appropriate antibiotics are used. A time comes when these are resistant strains developed. Here, a combination of Ganga-A and Shilajit plays a very good role. For chronic lymphadenitis, use of Sukshma Triphala and Gandak Rasayan for longer duration is very useful. Now, I would like to mention a few words about integration. Ayurveda is developed on Guna Siddhanta, while modern medicine is developed on Dravya Siddhanta. We cannot quantify Vata, Pitta or Kapha because they are to be studied by Anuman Praman. One such haphazard attempt was done on Guglipin. Guglipin was derived from Commiphora mucul. Commiphora mucul is a immunostimulant as well as immunodepressant. If you try to extract one of the helpful part of it, it becomes a reductionist aspect. And Ayurveda never advocates reductionist approach. Ayurveda believes in holistic approach. While considering the management of modern diseases like retinitis pigmentosa with Ayurvedic drugs, it is necessary to explain its dosha-dusha samochana, samprapti, according to Ayurveda, and it is mandatory to explain how Ayurvedic drugs have made samprapti bhanga. I would like to add one more thing. In Shatavari, phytosterol has been isolated and it is used for menopausal disorders. The trial is going on. In real words, this integration, which our beloved Prime Minister has advocated, and we should stick up to that. With these words, I conclude my topic and thank you all for patient hearing. Thank you very much.
Thank you very much, sir, for sharing wonderful information with us and a very informative session. Now, I would like to request there will be a question and answer session. So, if anybody is having any question, they can ask. Anybody would like to ask any question, they can ask.
Excuse me.
Yes, please.
Sir.
Yes, please proceed, sir.
Yes, sir. Just, sir, this infection, concept of infection in Ayurveda, the except, as you said, the Rakshasa or Sankramika Vyadhis or this Janapadodvamsa context, that is okay. But I don't think the Ayurveda, except in this context, rest of the DS infection is the reason, and whatever the drugs mentioned against various infectious disorders according to modern are not infectious disorders according to Ayurveda, which are based on the imbalance of the dosha. If, for example, Kasa or Atisara or Rajekshma and very first chapter and wide Joras, all these are basically the imbalance of or vitiation of doshas. And here, no concept of infection is either Bhuratraya or Lagatraya anywhere explained. Only, yes, according to modern, there may be culture and sensitivity done, there may be infection. But according to Ayurveda, it is Tridoshika imbalance. It is very clear.
So
and let me complete, sir. Let me complete my question.
Okay.
So, when but infection is there, and according to modern system, according to Ayurveda, it is doshik vitiation. And this is, according to Ayurveda, treated the doshas by Shodhana and Shamana. It is not unlike a modern system, any infection, it is antibiotic. Maybe culture and sensitivity, some of these maybe some slightly variation of antibiotics. Broad spectrum, in general, if it is a mild infection, almost all infections are treated. But it is not so according to Ayurveda. So, as far as the Sankramika Rogas and this Graha Rogas, to some extent, that is okay, Janapadodvamsa also, because epidemic, endemic, all this. That is Agantuka. First there will be injury, then dosha, dosha differences takes place. So if the infections and the various drugs used in Jwaras and Rajakshma, and they can be called as antibiotics, and I think this makes a lot of confusion among Ayurvedic community. So I want the clarification from you, sir.
Yes. basically the example I gave about the diabetic retinopathy. See, what happens now is that everybody tries to talk about integration. Integration is mixing of some parts from one science, some from parts from other science. This is 100% not acceptable to any of the sciences. As you rightly pointed out, Ayurveda is based on its own principles. It has the process of dosha, understanding hetu, samprapti, and samprapti bhanga is the chikitsa. In modern explanation, the causative factors, the relative antibiotics, etc., are there. What I would like to comment or say that there is no point in mixing these two sciences together. It's absolutely wrong. I entirely agree with you. Because the basic understanding of the sciences is totally different. Ayurveda is based on Guna Siddhant, whereas modern medicine is based on Dravya Siddhant. Pratyaksha Praman applicable to Ayurveda is to a limited extent. It has to be understood by Anuman Praman. So, I entirely agree with you that this is an attempt to show that there are some similarities. However, what I would like to recommend is that use of, maybe don't call it as antibiotic, don't call it as anti-cancer drug, but when the drugs are available in Ayurvedic formulary, which are useful for management of the disease in a proper way, why not use it? Nomenclature and calling it is a totally different area. I think I have made the point clear. I entirely agree with you that there is no point in mixing the basic principles of two entirely different sciences. I hope I have made my point clear.
Okay, I do agree, sir. When it comes to the treatment aspect, and we give our treatment according to Doshik
yes.
and Doshik analysis, and
Absolutely.
according to modern they give antibiotics, but still based on Doshik analysis, when we are giving treatment, and it is very well effective. A very kasa, for example, it is very common as respiratory tract infections, but our kasa chikitsa is highly effective, despite antibiotic and the anti-cough syrups are not effective. But to some extent, if specific antibiotics are given, maybe controlled. So, but in this aspect, our drugs are more effective. Just see, I am not fanatic. I am not posting of Ayurveda, sir. But
there is no doubt about that, and I don't deny that. Ayurveda is our science developed in India for thousands of years, and it has time tested. We have to make it as known and understandable to the modern world. If it comes to that, using the modern parameters to prove the efficacy of our drugs, well, we do not hesitate for that. If someone wants the in vitro or in vivo trial, we are ready to go for that. When we claim that the metals we use are safe, biosafe, we have to prove it. You remember the 2002 article in JAMA. They were published because Ayurvedic drug entry in modern world they wanted to prevent. Pharma industry was behind that. And so the drugs containing metals are absolutely banned in Europe and America. My explanation was not accepted by JAMA. I had mentioned that we are not shy of saying we use metals, but we treat them in such a way that bioavailability of metals is negligible, so they don't have any bad effect on the body. But it was not accepted because they wanted Ayurveda not to be popular in their countries. This is unfortunate part, but we have to be with that and fight against that.
Okay, I do agree, sir. I do agree with you. See, as far as the Western, there is a lot of opinion that our system has not been has been to some extent maintained low profile, but basically the disease procedure, pathogenesis, dosha samprapti, all are, I think, very scientific. Only the thing
Yes,
is, you have
there
to
is
come
no doubt.
with
There
the
is
proper.
no doubt about that.
We have to come up with the proper
Correct.
modern knowledge, modern basic sciences to explain it.
Yes.
But the getting
To
into
some extent.
modern,
To some extent.
actually into the infections, I think that is not the accurate method. That is what I wanted to emphasize. Okay, sir. Thank you so much for the explanation. Okay.
Thank you, sir. Any more questions from the viewers? Any more question they can ask? Anybody would like to ask anything? Please don't hesitate. They can ask. Okay. We can now we may conclude our today's session. So on behalf of our AV team, I would like to express my gratitude to our respected speaker, Dr. Vijay Doifude sir, for his knowledgeable explanation on a topic, infection from Ayurveda perspective. Thank you so much, sir, for enlightening us with your detailed discussion on a topic. Thank you, sir. I also would like to thank wholeheartedly respected Padma Bhushan Vaideshwar Devendra Tribhunaji, President of Governing Body RE, for his blessings and continuous encouragement. I express my humble thanks to Vaideshwar Manoj Desi ji for providing us his immense support and guidance. We are highly obliged to you, sir. I extend my heartfelt gratitude to Dr. Anubhav Srivastava, sir, Director of RE, for his constant guidance and motivation. I thank him for valuable contribution and encouragement in all our efforts. I must thank the organizing team of RED and volunteers who work behind the scenes for this tremendous efforts to make this webinar series a great success. And I am also thankful to all the respected Gurujanas participants who are constantly connecting with us throughout the series to make this series a successful one. Now, the topic and speaker for the next webinar will be shared with you very soon. Thank you all and have a nice day. Thank you very much, sir. Have a good day.
Thank you.
Thanks.
Thank you.
Thank you.